I'm Sherelle Gibson. I'm an OBGYN here at Goshen Health. I work in both the outpatient facility and in the inpatient, seeing patients in the office as well as delivering on labor and delivery. We see women of all ages in our practice. It starts from adolescence, where it's beginning that first visit with a gynecologist, to getting our young patients pregnant, and then it goes on to another phase of their life where we're looking at problems they may be encountering, whether it's bleeding issues, trying to find the right contraceptive for the correct space in life that they're at. If I had to move on beyond that, it's when they're into their menopausal area, where we're looking at bleeding issues, whether it's benign reasons or if it's even precancerous issues. And then typically we see patients when they're ready to complete their relationship with their gynecological parts when they're ready for a hysterectomy. In terms of anything you can do when you're sending patients to us to continue their evaluation or workup for any disease process, it depends on what the disease process is. If it's a simple issue like abnormal uterine bleeding, I would like for all patients to have had a current and up-to-date pap smear. That way, if we are addressing an abnormal uterine bleeding, we aren't immediately having to pivot and discuss issues with an abnormal pap smear. That could be all part of that consult or referral if that was already done in the beginning. And then a pelvic ultrasound. Having that done ahead of time helps us get started with the options for management in a more timely fashion. We are all really adept with the Da Vinci and minimally invasive surgery for whether it's hysterectomies or ovarian surgery. However, we have so many other options for management. So if a patient is saying they don't want surgery, that necessarily doesn't mean they don't want to be referred to an OBGYN. We can walk through some of those less invasive modalities with them if that's something they're interested in as well. There's so many more options for managing so many different conditions. So it's not a one-size-fits-all, and I think we do a really great job at tailoring the options for the patient, even if they're not specifically available through us, and allowing them to make a good choice for them.